we have Dr. Imodoye here with us. Dr. Imodoye is a medical doctor and is going to be speaking with us about why young people should be a part of health tech and the future of health tech. So, Dr. Imodoye, over to you.
Hello, good morning, everyone. Thank you so much for, I hope everyone can see me and hear me.
Yes,
been
we
having
can.
a bit of connectivity. Absolutely. All right. Thank you. So, hello, everyone. My name is Imodoye Abioro. I am a doctor and I'm the co-founder and CEO of a health technology company called HealthTech Limited. We are a company that builds automation software for pharmaceutical and biopharmaceutical laboratories around the world. It's a pretty interesting field, and it's been a rewarding experience, particularly with the age of AI, where traditional to be one of the few companies in Africa that is, prominently represented in the field. It was a real honor to be invited here to speak about technology and the future of technology and why young people need to be involved in the future of technology. And so for the next couple of minutes, I'm going to take us through some of the key things that around the world are talking about when it comes to technology and why it's so critical that young people, even older people, to be fair, need to start getting involved actively from the ground up when it comes to technology and technology innovation systems. And so without further ado, I will just kick off. I'll share my screen and I will just kick off. But before we get to what's on my screen, I want to start by explaining what happened after COVID-19. So everybody in this room, I'm sure, was around when COVID-19 happened. And when COVID-19 happened, what really happened was that we had a disease that was spreading all around the world. And while every other continent was putting in measures in place to fix their systems and grab resources to keep their people safe, we had one continent with 54 countries that was basically waiting to be helped. Unfortunately, that continent happens to be our own, right? It got so embarrassing that we had public officials going on public channels to beg for ventilators, right? And I want you to stop and think just for a moment about how we don't learn from our own history. Because this same country where we had public officials going on public social media to beg for ventilators is the same one that had an Ebola incident, that the only reason why that incident didn't wipe out thousands of people was because we had a brave doctor, the very brave and wonderful late Dr. Stella Adadevoh, who sacrificed her life literally to ensure that thousands and thousands of Nigerians did not die by stopping the first patient, Mr. Sawyer. So basically, we had a scare just 9 years before the COVID-19 issue, where someone had to die, a doctor had to die so that many other people would not die. And the health system made her a hero, yes, but we did not learn anything from the fact that we were one doctor's death away from burying tens of thousands of Nigerians. We didn't fix any issues from that incident. We didn't learn anything from that incident. She died, we made her a hero, and we moved on. 9 years later, we had a pandemic. This time it was everybody's problem, not just our own problem. And it was obvious we didn't learn anything because we started begging for basics in public. That pandemic happened. It killed the third most powerful person in this country. It killed the governor of my state. It killed so many people that were supposed to be important people. And you would have thought that, okay, now that this one actually killed like people in our leadership class, we are finally going to wake up and fix our problems. No, that did not happen. because we are now 5 years post the pandemic and none of those problems have been fixed. Right. And so this meeting is super important because I know that some of you want, I've seen the audience insights, and you really want me to talk to you about where should you get involved, where should you get in from the ground up. And that's really what I'm going to talk about. That's why I'm not so keen on just sharing slides. I'm keen on starting from where the problem is. Right. So we had all of these problems and we didn't fix any of the issues. Right now, so what are these issues? So let's talk about what these issues are. Let me start by saying that technology is at the basic foundation of any field of endeavor. Healthcare is not an exception. And unfortunately, and I say this very, very sadly, very unfortunately, in Africa today, our entire health system is subsidized and underwritten by the West. And I'm going to use real examples. I want to take one workflow in healthcare, just one workflow in healthcare, the admission of a patient and the transfusion of the patient with blood. I'm going to take that workflow and I'm going to show you how every single thing used in that workflow is not made anywhere close to this continent. And that's such a shame because it means we don't own the healthcare. We basically have, in this room, I've heard that we have doctors here, we have other healthcare professionals here, and that makes me really proud because that basically means we have people in this room who are full of the knowledge of what to do, but essentially all of the tools you're going to rely on to save lives and fix people and make them whole again, you don't own any of them. You're at the mercy of a Chinese man, an American man, an Indian man, and if they are not happy with you for whatever reason, you're stuck. If our government does not have hard currency to pay them, you're stuck. And so half of the problems you're seeing today in the healthcare industry stems from this fundamental fact. Our entire healthcare system is underwritten by the West. We do not own a single input that we use to make people whole and well. And that is ridiculous. No country, none under the sun that is respected, that is self-respecting, will ever let their healthcare to be like that. We are the only people who, for some reason, have no problem with that. Even the South Africans are not like that. Even the Egyptians are not like that. And so, back to the example I wanted to use, which is a patient that is sick, and we want to transfuse this patient. Let's start. When the patient comes in and they are going to be admitted, right? We write supplies for them for the admission. Everything we're going to write for them is going to be imported. The gloves, the syringes, the needles, the embrocation alignments, so crepe bandages, plasters, cotton wool, all of that is imported 90% of the time from China and India for the most part. Yes, thankfully, there are now a few companies in Nigeria, like one or two, that are now producing these locally, but they are not even at capacity yet. In majority of cases, if you don't believe me when you get to work today, just check made in where on everything that you're prescribing out. It's made in China and made in India. Sometimes, yes, you will see packaged in Ogun State, but look at where it was manufactured, not where it was packaged. Packaging is just adding everything into a box. Look at where it was manufactured. You would see it was manufactured in India. So all of the consumables imported right now. So you've written that for the patient. Now it's time for the patient to get on a bed. The bed that the patient is going to sleep on. And this is really just to show you how ridiculous everything gets. The bed the patient is going to sleep on is also important. Please, what is the technology innovation in a hospital bed? To be frank, like, what is the technology innovation in a hospital? It is a bed. Most of these beds we're talking about are not even advanced automated beds that automatically adjust themselves based on patient body pressure or anything. These are basically standard metal beds, and we import those from China too. Right. So the patient is on the bed now, and it's time for us to transfuse this patient with blood. Guess what? The tubing that you're going to use to transfuse this patient is also important. The blood bag is important. The anticoagulants in the blood bag is important. And so basically, we've just walked through a standard workflow for caring for one patient, and we don't own anything that underlines that entire workflow. And that's really the challenge and the alarm that is going on right now. We do not own the healthcare system that we claim to run. We don't own it. And that means that you and me and every other person who is our colleague in this field is basically at the mercy of foreign exchange policies that our governments make, foreign governments and their own views of Africa and what they want Africa to do, foreign producers and manufacturers who have no idea where Nigeria is on the map, but they sell into Nigeria anyway. So basically, the incentives are not aligned. And so when we come to a meeting like this and you say, Doye, why should young people get into technology? My answer is very straightforward. We have an existential crisis. If we do not start fixing our own problems, we're going to all regret it in another 10 years when a real pandemic that is actually lethal happens. Let's be clear. The only reason why Nigeria does not have mass graves from COVID-19 is because COVID-19 happened to not be a lethal disease. And I want to make that absolutely clear for everyone on this call. If COVID-19 was anything like SARS, the original SARS, the one that happened in China, in the early 2000s, I know COVID-19 has a SARS-related virus, but I'm not talking about this one. I'm talking about the SARS, the one that happened in China that never became a pandemic. If that one was the one that happened to be COVID-19 and spread abroad, we would have literal mass graves for millions of Nigerians. There's no question about it. We did not do jack in COVID-19. Yes, we ramped up testing. Yes, we had activities that looked like we were working, but let's be very frank with each other. I do not like to lie and I do not like to sugarcoat things. If that disease was deadly, there would be a mass graves and mass memorials around this country in honor of victims who died in that pandemic, because we did not solve jack in that pandemic. And that's why the third strongest man in this country was dead. My own state governor was dead at the end of the pandemic. And basically what I'm saying here without equivocation is, well, we're not ready for whatever the next pandemic is going to be. And God help all of us if that pandemic happens to be a deadly one. Some of us may actually even go with it. And that's the truth, because we will be frontline healthcare workers. We will be the ones facing these patients when they show up at the hospital. And so if the government or the people in power would not see this as a crisis, then we ourselves must not be clowned by ourselves to not see this as a crisis. We don't own a system that we're supposed to be custodians of. That is a problem, a serious problem. The entire supply chain of the healthcare system is run by foreigners. And so when you ask me, Doye, why should healthcare workers, why should young people get in the ground floor when it comes to health technology? My answer is we need to own the supply chain. I'm going to use one more example in my own career again, because the reason why they called me to talk about this is because it's primarily a problem that I have spent my career trying to solve. So I'm going to use one more example in my own career just to drive home this point again. I started working in the field of technology, in healthcare technology, about 8 years ago now. And when I joined, I started working at the WHO's Office of Innovation like 8 years ago. And when I joined the technology space for healthcare, one of the first things I quickly realized is that not only were we underrepresented in terms of the fact that there were no Black people in most of these rooms, it was also that we were underrepresented in the pipeline, in that when I looked back behind me and I'm like, okay, God forbid, if I pass away today and I'm no longer in this room, who is going to take my place? It didn't look like anybody that looked like me, right? And so while you would have the South Africans and the Egyptians and the Moroccans having good representation in these rooms, Sub-Saharan Africans were not anywhere near it, right? And the best example I can give is in the laboratory and the scientific subsector of healthcare. Because a lot of times when we talk about healthcare, we focus a lot on hospitals and the pharmaceutical sector. But let's be clear, 60% of diagnostic decisions are made after a lab test is done, right? So it is just as critical as pharmaceutical and the clinical subsectors. And I'm going to use the laboratory as an example. In Africa today, and I'm not saying like yesterday, I'm saying today, this morning, 18th of April, as we're having this conversation, less than 0.1% of laboratories around Africa have a digital system that runs them. Today, not today, 2026, not, historical data. Less than 0.1% of laboratories in Africa have a digital system that runs them. For those that have a digital system that run them, of course, you know where I'm going to say next. All those systems are foreign systems. They are built by foreigners who, sell into Africa. But that's not where the issue is. When I started looking at that problem and I started, and I left the WHO to start my company and try to, tackle some of those problems, here's what I found. That we were paying, and this is the part that should annoy you, that for the same technology that the Indians would make in India and charge $10 for, when the Indians came to Nigeria, the Indians would increase the price by 33%, 33 times, so 330%, meaning they would multiply whatever they were charging in India by 33 and charge that value in Nigeria. So if they were charging $10 for this piece of technology in their own India where they made it, when they bring it to Nigeria, they would charge $330 for that same piece of technology. And the reason why they could do something so ridiculous like that, and we would buy it, by the way, let's be clear, is because there was no local competition. So essentially, the Indians had figured that whatever costs they bring it down to our market, since we can't produce it by ourselves, we are stuck. We either buy it or we don't have it. And obviously, since we need it, we would buy it. And that's why all of a sudden, all of the local companies that should be self-respecting and investing in making local capacity a possibility would now become distributors and manufacturers, distributors and resellers instead of manufacturers. So we have big healthcare companies in Nigeria, Crown Healthcare, this pharmaceutical, that pharmaceutical, and all these other players, and all of them were reduced in their own country to the role of distributor instead of being manufacturers. And so when my company started and we saw this ridiculous price disparity when it came to laboratory technology, we said, no, this cannot be possible. This does not make any sense. They approached us too and said, we should come and be distributed. I'm like, hell no, I'm not distributing anything for you guys. I'm making it. I'm going to produce this and sell it to my own people. Because why in God's world would you sell this same product? Because I've been to India, I've been to your country, I've seen you sell this same product in your country for $10, and then you're in my country selling it for $350 to my own laboratory. That's ridiculous. I'm not going to have that. I'm not distributing anything for you people. And so we went to the competition with them. Of course, it was tough, but thankfully we're winning now, and that makes me happy. But that's why I'm here today, because the truth is, you and me need to understand that there are people who are taking advantage of us solely because they know that we have no local production capacity. And some of these technologies, like I said, are not even advanced pieces of technology. I go back to the hospital bed example. We import more than 95% of the hospital beds we use in this country. Please, there is no piece of ingenious technology in making a hospital bed. You've all seen hospital beds. Where's the technology there? And so the reality is, the reason why you and me need to care about technology, about healthcare, particularly healthcare technology, and getting on the ground floor when it comes to building these pieces of technology, is because right now we are being ripped off. And the funny thing is, the reason why this rip-off should concern you is because it is directly contributing to why healthcare is expensive. Because when the hospital and the pharmacy and the lab have to pay for all these things exorbitantly from abroad, what happens is they transfer that cost to the patients. Remember, we don't have a lot of insurance penetration in Nigeria, unfortunately. It's getting better, but it's not there yet. And so what naturally happens is, when all these input costs are so high, the business does not want to run at a loss. So what do? They transfer all of that cost to the patients. And all of a sudden, healthcare costs are skyrocketing. Poor people can't afford healthcare, because a lot of healthcare is paid for out of pocket. And so if you and I are going to help the patient get better healthcare, and if you are already inclined into what technology could do and what technology can do, this is a call to action. This is a call to action. You need to begin to look at, in your own capacity, with your own networks and the people that you know, what is possible in terms of getting involved in producing critical components of the healthcare supply chain. We need more, because we are being ripped off. And I'm not even saying this as someone who is trying to be patriotic or Nigerian and Nigerian first, or a local kind of politics. No, I am saying this because it is true. I have seen it. These foreign producers in China make medical equipment and medical diagnostic machines dirt cheap. You'd see a hematology analyzer going for as cheap as $200, $150. All of a sudden, you cross over to Computer Village in Lagos, or you cross over to Alaba in Lagos, and that same diagnostic equipment is $2,000. And you're wondering, what happened? I mean, yes, ports, importing and all that is not cheap, but it is no way that the same product that was $150 in Shenzhen all of a sudden transformed and arrived in Tinkan Island and became $3,000. That is not simply how it works. That's not how it works. So what is happening is that people are realizing that because there's no local capacity, there's nobody that can stop them from inflating prices, and they are basically just doing that. And what they are doing inadvertently is that they are piling up more costs into the healthcare system, making it impossible for the patients to afford healthcare. And that is what is actually adding to our worsening and declining healthcare indices. Of course, I could sit here and talk about the government's fault all day, but we're not here to talk about the government. We're here to talk about what we can do. We know the government has its deficiencies. I could spend the rest of this meeting telling you where that is the problem, but that's not going to change anything, right? What can change something, because I have seen it change things, is when we begin to look at the supply chain and ask ourselves, which parts can we take over? Which parts can we actually get involved and take over? My company looked at a lot of different parts of the health supply chain, and we decided laboratory automation and laboratory software technology was something we could take over. And that's really where we are now. And I can tell you free of charge that many of these foreign made products, we've replaced them massively in so many of our local labs, and they are even inferior. Just 2 weeks ago, we took over a laboratory, an ISO 15189 certified laboratory in Nigeria, one of Nigeria's bigger laboratories for private purposes. I won't mention their names. So we took over the lab just 2 weeks ago. We completed our installation for the lab just 2 weeks ago. And before we came, this laboratory was spending $30,000 every year on this piece of technology made by Indians and Americans to run their laboratory operations. $30,000 every year. That was how much they were paying, and they were almost on the verge of death. Of course, on the outside, you would see that because you're not in the business. But when we got into the business, their finances were in complete ruins because they were bleeding so much money to maintain this tech. And without the tech, they couldn't keep their certification. They couldn't keep running. So what were they doing? They were just ramping up the prices of tests. We came in and obviously replaced that piece of technology for less than 2% of the cost they were paying before. And it got me so angry because this is us being bullied in our own country by foreigners who have come to see our own lack of capacity and have decided it's a business opportunity for them to exploit. The question to you today is, will you let them continue? So let me go to the next part, which is how do you get involved? Because a key part of this, I mean, I've told you the problem, I've talked about how bad this problem is, but you obviously would want to know, so what can we do about it, right? And so let me start by saying that there are multiple ways to get involved in this, right? First is simple advocacy, right? One of the reasons why this problem has gone on for so long is because nobody talks about it, because few people actually know about it or understand the gravity of the problem. And so there's very little talk about this. And as a result of that, most people, sadly, just gloss over the problem and keep going. And so one of the first things we can do is talk a bit more about it. When your facilities are procuring things, ask, is this the best one that we can procure? Must we buy from the foreigners? Are there local alternatives that we could procure? Because many times there are none. That's the truth. But in the few instances where they are, we should actually start working on phasing out foreigners in our supply chains. And that's really key because we cannot have independence and autonomy if we don't phase out foreigners in our supply chain. Americans don't run the American healthcare system on Chinese goods. The South Africans don't run the South African healthcare system on Indian goods. So why in God's world are the Nigerians running the Nigerian healthcare system on Chinese and Indian and American goods? It doesn't make sense to me. So we need to talk about it. So advocacy is something that you can actively start doing today. It doesn't require any technical skill up. It doesn't require any certifications. It's just talk. you are in positions of influence in your different facilities, and you should start having conversations about that. When and how can we start phasing out foreigners in the key portions of our supply chain? What are the local alternatives? The second thing is, for those of you who are entrepreneurial, and this does not require, again, technical skill, it just requires you to be bold and have a bit of capital, because capital is hard in Nigeria. But for those of you that are a bit entrepreneurial, let me tell you free of charge that there are huge opportunities in the healthcare supply chain in being a critical supplier of healthcare and medical supplies. There are funds that are available for support. The president has a particular initiative specifically designed for this. It's called the Presidential Initiative for Unlocking the Healthcare Value Chain. It's called PVAC. Their website is pvac.gov.ng. You can check them out. It's a standalone initiative in Abuja that the President Tinubu, established specifically for this problem. Because thankfully, it looks like some people in his government at least understood that we had not learned anything from COVID and tried to start fixing the problem. So it's not in the Ministry of Health. You're not dealing with government officials. You're dealing with people who have experience in the private sector. I have good friends at PVAC. They've been really amazing people. We don't really do healthcare supply, so they've not really been people we can work with directly, but I know them. I know the work they do. And I'm saying it right here and now that if you're entrepreneurial and you have a bit of capital and you think it's something you want to risk, because business is always a risk, obviously, one of the things you should begin to think about is getting involved as a manufacturer. You don't even need big to start big. Pick something small. Maybe it's just gloves or syringes and needles, something that is small enough that would not obviously require endless capital. And begin to think about if it would be a good thing for you to get involved in production in that supply chain. Because the truth is, we have gaps. Importing all of these things instead of making them at home is driving up our healthcare costs like crazy. And we need to start asking ourselves, some of these things makes no sense that we're importing them. Why are we importing hospital beds? I've said that like 4 times because it's so irritating. There is no piece of technology in a hospital bed. A hospital bed is a goddamn bed. Forgive my language. So why in God's world are we importing that? And so if entrepreneurship is something that you think you could, stomach with all of the challenges that comes with it, I would strongly encourage that you're already in healthcare, you have the connections, you have, people, even if you're still junior or young in your career, you're already in the space. You have people in your level, you have people who are senior to you, who will listen to you before they listen to an outsider. And this is something I have come to see. Many of our seniors in the field would actually listen to us when we show them that we can do this thing differently. So I'm also young in the healthcare space, so it's not like I have senior level experience. But when I started my company and I started pushing back against this foreign reliance and foreign interference in our healthcare chains and started pushing for substitution of some of these critical systems with our own systems, my senior colleagues, were very happy to listen to me. They were like, well, Imo, it's not our fault. We didn't really know anywhere else. Nobody was doing this, but well, since you're doing it now, yeah, we're gonna go with you. And I've had a lot of success just because they know I'm one of them. I'm an insider. This is my field too. This is my profession too. And many of you also have that same advantage. If you're an insider, insiders are more likely to listen to you than to listen to some foreign guy, some Indian guy, some Chinese guy. The reason why they still keep listening to the foreign Indian Chinese guy is because there's no alternative. And so right now, they basically just have to go with what they say. And so if healthcare entrepreneurship is something you want to do, particularly in the technology side of things, supply chain is something that really needs a lot of people. It's shameful, and I repeat it again, we import blood banks. I would like to ask, what is the technology or innovation in a blood bank? Why do we import blood banks? Because believe you me, the reason why blood has become so prohibitively expensive is because everything apart from the human blood that goes into that bank is imported. And so the moment our Naira spiraled out of control under President Buhari and all of the terrible things they did, and of course under President Tinubu and all the more terrible things they also did, unfortunately, the moment the Naira spiraled out of control and moved from one something to 1,400 as it is today, the cost of all of those inputs just went with it. And that is how blood went from 7,000, 8,000 per pint to 40,000 in some places today. And so if you need a blood transfusion in Nigeria and you're not rich, God help you, you're looking like the doors of death. These are things that we should have control. We should have been in charge. Why are we importing blood bags? Why can't we produce blood bags at home? What is the blood bags that we are importing them? And so, I repeat, if entrepreneurship is something you want to do, and the healthcare supply chain is what I'm going to tell you to look at, the opportunities for entrepreneurship in healthcare are not in starting new hospitals or starting new labs. Don't get me wrong, I do not have any beef with people starting new hospitals or starting new labs. We need more, okay? But if instead of taking that capital to start a new hospital or start a new lab or start a new pharmacy, I would say if you have that capital or you have people who have access to that capital, think about starting a company that builds critical components of the healthcare supply chain. Think about that. And I'm more than happy to, have more conversations outside of this forum with people who may be interested in getting started in that direction. And very importantly, if you are doing healthcare supply chain, please contact PVAC. As long as President Tinubu is still in power, which means they are still going to have his backing because it is specifically his own idea. And so right now, you have a president and an organization that is designed to back you up. Use that opportunity now, because when he leaves, and he's going to leave eventually, either after this election or after the next one, but he's going to leave. And when he leaves, you have no guarantee. You know how Nigeria works. You have no guarantee that the next administration will care about this problem. And so if you're starting, please make sure you reach out to PVAC. You could pay them a visit at their office. You could visit their website. You could talk to me. I could connect you to them. I have people there. They would be super helpful to you if you're thinking of going in that direction. So that's second. Now, let's talk about specifically people who want to get into the tech side of things. Unfortunately, there's no easy way. I wish I could come here and tell you that there's this 6-month course you can go and learn, and then boom, you'll be able to build health technology. It's a life. There's no such thing. In fact, I strongly discourage people who want to go into health technology and are not fully motivated to learn all of the hard parts of healthcare and technology before getting it, because the inordinate joining of health technology by people who should have no business building health technology is the reason why the EMR revolution in Nigeria has caused more problems than it has solved. Because we had people who had no business building EMRs, because why in God's world is someone who has never seen a patient building EMRs, sadly, and now they built EMRs that did not follow any healthcare data standards, did not follow any interoperability standards, and now we have hospitals that run EMRs, but those EMRs are completely useless because the Ministry of Health cannot connect to the EMR. The EMR cannot share data with other hospitals that may need it. It cannot contribute to research. It is just a glorified database. And unfortunately, it pisses me very much off, because while most people don't understand how harmful those technologies have now become, I do, because this happens to be my life's work. And because instead of now having all this wonderful healthcare data that we can work with at the national level, we have healthcare data trapped in hospitals. Because those systems were never built with the mindset of interoperability, because they were built by people who were not healthcare people, who had no idea how healthcare systems work. They were just people who knew how to code and who thought, well, since I know how to code, I can build an EMR. It upsets me. And so I'm not going to sit here and encourage more of such terrible choices to be made in healthcare landscape. So if you want to get involved in healthcare technology in the software categories, that means you're building technology that powers healthcare workflows, I would start by saying that it's not a short process. You would need to learn two things simultaneously: healthcare and data standards and healthcare processes and how they work, which is different from clinical work, because most of us in this room are clinicians. So you're going to need to go away from the clinical side of things to the administrative side of things and how standards were built. Once you have good grounding in that, you would then obviously have to get grounded in technology itself and know how to build healthcare technology, how to build, technology on top of healthcare data standards. So it's not a short process. Using myself as an example, it took me 4 years of constant learning and training to even start to figure it out. And I started back when I was in medical school, right? So it's not a straightforward process, but I'm not here to discourage you, I'm here to encourage you. So let's go straight into what are the things you need to do. First is you need to understand that interoperability and data standards are what makes healthcare useful. Technology in healthcare is only useful when, one, that technology helps improve clinical processes for the clinicians like you and me. Two, the data that technology gathers is useful for public health surveillance and other meta hospital or meta healthcare organizations like the Ministry of Health, like international NGOs and all that. So you need to build with that idea in mind, that technology in healthcare is only useful when, one, it improves clinical workflows directly, and two, it contributes to the bigger health system in terms of data aggregation, in terms of intelligence and insights. And so the way to get started is to first study and understand healthcare data standards. So you're going to need to understand and study the ICD, the HL7, the FHIR. FHIR stands for Fast Healthcare Interoperability Standards, FHIR. So these are the world-leading data standards that international healthcare systems in every country in the world is built to model after. So there are 4 of them. The DHIS2 is 1, HL7 is 1, FHIR is 1, that's FHIR, which I just defined, and the ICD, of course, is 1. And you're going to need to know all of them, not 1, not 2, unfortunately. You're going to need to know all of them because they have different roles they play at different points. Now, a grounding and an understanding in this is easily accessible. All these organizations I mentioned have websites. They have courses on their website that are designed for people like you and me who are thinking of getting into healthcare on the ground floor. Once you understand these, right, once you have a good grounding and understanding of these, then the next thing is for you to get yourself an education in technology and how to build healthcare technology. For that purpose, I would say that in this age and time, the programming language you need to get familiar with the most is called JavaScript. Now, do you all need to become programmers? No. Do you all need to go and learn how to code? No. If you have a good grounding and understanding of those healthcare data standards that I talked about, you are already an invaluable asset to the sector, because you now have clinical knowledge and administrative knowledge that you can use to advise health tech startups that are starting in the space, that are trying to build. Because most of these startups, unfortunately, are started by people who are not healthcare professionals, but they need advice. They need co-founders. They need critical stakeholders who are going to help and advise them on what to do the right thing. You then become that critical co-founder, critical stakeholder who directs them in the right direction. Let me say this and wrap this up. The biggest supplier of EMRs in Nigeria built a product that nobody else can connect to, that cannot sadly provide data to meta organizations unless they have a direct relationship with it. And the outcome is that they stuck. They are not growing anymore. They are not able to exit the markets because the data they have is valuable to them and their partners, but not valuable to anybody else. And so nobody's going to buy them. And that's such a sad outcome for a company that was so well celebrated, so highly funded. But it's a lesson for everyone on this room. Don't go ahead and make the same mistakes. If you're going to start a company that is going to be in healthcare, please be at least reasonable enough to have someone who is a core healthcare person direct how that product is built. Don't go ahead and build products in a field that you're not an expert in. It's ridiculous. And the fact that it even happens in countries like this is just part of the failures of governments and regulation. Because in other countries, in the US, you're not going to build an EMR in the US without passing on-quant certification. For you to pass on-quant certification, there needs to be somebody who is a certified physician on your board. Again, these are lapses that the government have left in place, fine, but we're not discussing government today. We're discussing among ourselves like a family. What can we solve? And I'm saying what we can solve as a family today are problems in our healthcare supply chain, where we need to actually start taking responsibility for those things that we use to care for our own patients, because I think it has been irresponsible for us to let it go for long enough to the point where now foreigners are ripping us off in our own home. And then second is, if we're going to go into the technology side of things, that is the software technology, operational technology side of things, then we need to start by ensuring that we're building with the right incentives, meaning we're building for interoperability, we're building following data standards, which allows us to connect the Nigerian healthcare system to any other healthcare system out there that may be beneficial to us. Today, we can't even consume a patient who comes to Nigeria, who lives abroad, who comes to Nigeria, receives care, and goes back home to their country, wherever they came from abroad, cannot take their records from Nigeria abroad because our records are not structured in a way that can interoperate with any other healthcare system anywhere. That is such ridiculous stuff, because that means we may not see the problem, but that automatically means that when those other systems have research that could be beneficial to clinical patient care, we can't ingest those research. We can't ingest it directly because we don't have systems that are shaped to consume such data. And so we are more and more isolated in the field on a global scale. And so I believe that the summary of what I'm trying to say, because I don't want to get overly talkative. We have a question and answer segment, and I'm sure you have specific questions for me. But I believe that what we really need to talk, what I'm really talking about is there are three things we need to think about. First, as healthcare professionals, our life is in danger. The next pandemic that comes that happens to be a proper disease, I am not underestimating or I'm not trivializing the work we did in COVID-19, and I thank God for all of us. I'm sure every single one here in one way or the other was involved in that response, and I'm thankful that we all made it out and we're all here. For those that were still in school, even students were involved, right? So I'm not trivializing what happened in COVID, but I repeat, the only reason why there are no mass graves around Nigeria is because COVID happened to not be a lethal disease by design, by nature. What I'm saying, therefore, is if we ever get a disease that is anywhere near as virulent as Ebola or Lassa or the original SARS, right, and it happens to be pandemic level exposure, we would have mass graves, serious mass graves, people dying in millions, because our health system is still not designed to be resilient for mass public health needs. We don't have the capacity, we don't own the supply chains, and what will happen again is this shamelessness you saw during COVID-19, where leading government health professionals ended up on Twitter and social media begging for ventilators. It is madness, it is insanity, and there's no other way to define it. But the fact that after that insanity, everybody just went back to life like it was normal shows you that it is our own lives they are playing with. Because all these shameful people who were begging for ventilator on public social media are not the ones that are going to be in the A&E. It's going to be me and you. It's me and you that are going to be in the A&E wearing face masks. It is me and you that are going to face those prescriptions, those samples, those patients. It's you and myself. And so if they are not going to solve the problem, us whose lives would be exposed, I think we should be more motivated to solve the problem for ourselves. And so first is advocacy. We need to talk more about this problem. Most of the people in power, most of our own senior colleagues who are in power in our own subsector are oblivious to how dangerous this trend is. Again, some of them are also complicit, actually, so it's not like they're oblivious, they're actually just benefiting from the rubbish. But many of them are actually genuinely just oblivious. And so we need to have more advocacy around this problem. The second and just as important part is for those of us in this audience today who may be entrepreneurial in nature, who may be thinking, what next can I do? I really want to do something that would change the world. I really want to do something that would matter. Well, I have a very important problem that I think you should care about. The entire healthcare supply chain is run by foreigners. The entire, not parts of it, the whole thing, from top to bottom. Pick any workflow that interests you in a clinical or paraclinical setting and tell me where we own. Even pharmaceuticals, where at least we thank God we have homegrown pharmaceutical companies, Nimed Pharmaceuticals and all these other guys, it's still not enough. We still have a lot of these things run by Indian companies, packaged in Nigeria. Many of these pharmaceutical companies are not producing anything. They are taking raw materials from Indians and the other people, and then they are packaging it and distributing it as their own products. Now, I would not advise you to get into pharmaceuticals because it's a whole different ball game and the capital requirements are insane. So I can't sit here and possibly say that to young people and young professionals like myself. Even I can't get it and I don't have that kind of capital. But you don't need to get in at the top floor. Let's try to get in at the top floor. There are smaller things that can be fixed, okay? Smaller things, which I've talked about today. So if entrepreneurship is something you want to do, please consider, getting into the supply chain side of things and being a producer of some of these critical components that we have no business importing, right? Lastly, if you're going to get into the technology side, the operational technology side of things, please make sure that you're getting in with the proper grounding and proper motivation, right? Don't let's repeat the mistake of the EMR revolution. We lost an opportunity. Now today, if you go to any hospital and tell them to get an EMR, they're going to tell you they don't want, because unfortunately, EMRs never delivered on their promise, because the people who were pioneers in this space sadly happen to be clowns. And I say that with respect, but I do not say that with respect. I think they were clowns, and it is very sad. So yeah, that's all about, that's what I want to say today. Thank you so much for having me. I'm more than happy to answer questions that you may have. I'm sure there are a few, and I'll be very quick in answering those questions. Thank you so much for having me.
Thank you so much, Dr. Imodoye Abioro. for a very much engaging session. I'd like to say I learned a lot from it. It was very impactful. It was very practical, and it came as a challenge to every person on this call, every person that will get to listen to this much later. And you emphasize so many things that people may not directly pay attention to, how we are changing ourselves by um, being distributors, being getting or making purchases, making money, making giving more opportunities to foreigners. Why instead of investing in ourselves, instead of bringing focusing on the problems and finding solutions to them locally. You emphasize opportunities for entrepreneurs, how many people could actually tap into the different opportunities that are existent in HealthTech space. And interestingly, you also made us realize we don't need to be all techies. We don't need to be techies. If you are interested in business aspects, there's a space for you. As a medical expert as well, there's room for you. I mean, there are so many things that we can, each person in this meeting, anybody that is interested in solving healthcare problems, there are ways that you can engage the opportunities, and then you can benefit the public at large. Thank you so much once again. I'm sure every member in the audience benefited maximally. But before I ask the questions I have from my end, I just want to know, do we have people in the audience who would like to ask questions from Dr. Abioro? We have let's give an opportunity to at least 2-3 persons. The timer is running. We have less than 7 minutes, or about 7 minutes to finish this section. Anybody? Are there no questions from Dr. Abioro?
Yes, I have a question.
Okay, thank you very much, Ms. Awoni Oluwashimleri. Could you please introduce yourself before you ask your question? Who are you? What do you do? And then go ahead and
All
ask.
right. All right. So I'm a foundation level computer science student in University of Lagos. I'm into the tech field, and I joined because I saw tech meets health, so I was quite genuinely interested in it.
All right, so please go ahead and ask your question.
Okay. So I noticed that when the doctor was presenting, I noticed he kept saying that there are no structures. Or I noticed that the problems that he is saying can be solved by tech experts. And when I mean experts, I mean these are what we are being trained in school. For example, there is a tech people called project managers. All they do is to look at existing systems, look at their problems, and prefer solutions. I feel that anyone going for a startup should actually include this set of tech people, because all they are doing is to look at your structure, prefer solutions to your structure without damaging the existing structure, because these are all things that we are learning even while staying in school. So I feel that anyone going into a startup should actually include this set of people, and it will go a long way in managing a whole lot of things, because yes, because they have like the skill sets to properly analyze a system without and prefer solutions, even whilst, and they don't need to look for a professional per se. They could look for those that are still in school, probably in the higher level, and the cost of hiring such people is actually lesser than getting a professional. Yeah, so that's just my input.
All right, thank you very much, Ms. Oluwashimleri Awoni. Well, that was more of a comment than a question. Dr. Imodoye, do you have anything to add or say to that? All right. Thank you very much. So
Yeah. That's very insightful, and you're definitely right about that. There are constraints though. We do not You do not trust entrepreneurs to do the right thing. You provide an environment for them to do the right thing. The government doesn't define anything. There are no standards, there are no input standards, there are no data standards, there are no structures that are enforceable. And so without that, you don't expect, relying on the entrepreneur to do the right thing is not the right way to go. But you are very correct that ideally, we should, entrepreneurs who are going into such spaces should engage with the right set of people, so that they don't end up messing up things that they meet up. So yeah, you're definitely right. I agree 100% with that call. But I think, unfortunately, regulation is going to have to be more mature for that to happen.
Yes, thank you very much. So, do you have other questions? Any other question? You can just directly unmute, or you indicate by raising your hand. Okay, while we wait for other questions, I'll ask from my end. Well, you emphasize a number of things, and I understand that the HealthTech space is one that is constantly evolving as opportunities exist. There are a number of things that we should also pay attention to. But just from your own perspective, what would you say, or what are the things that you would consider important to pay attention to over the next 5 to 10 years? Because when we think about these things, we think more in the long term, right? So what would you advise to pay more attention to over the next 5 to 10 years for the benefit of making impact in the long term?
Right. So for me, I mean, there's no questions about that. It's pretty obvious. Next 5 to 10 years is going to be all about AI and automation. Believe it or not, many of us are going to have to wake up in a world that is very much automated. It will take time for it to get to our own side of the world, but it will get here. 100%, I can assure you. And so for us, not even talking about entrepreneurship or getting involved in the space now, we need to make ourselves more AI native, more comfortable with the technology, how it works, incorporate it a bit more into some of our own workflows, so that as the system widely adopts more of it, we are already native in that space, right? Because it's going to be helpful. And it's only going to be helpful as much as we are familiar with it, because if not, it will be harmful. And the only reason, the way to avoid it being harmful to us is by getting familiar with it and, incorporating it as much as we can. So AI and automations are going to be a real part of, what the future holds for us. And I think that's the single most important thing I would advise any group of healthcare professionals gathered together to consider in the next 5 to 10 years in terms of what should you be looking at long term to incorporate more of and not less of. So yeah, that's it.
Thank you very much for your response. So one last question from my end. One major problem that we have identified is how as technology is taking up the space in healthcare largely, people in rural areas still suffer largely. Do you have any ideas on how we can bring them into the loop? How can they benefit more from these advances, these opportunities that exist?
Right. I'm not so sure time would allow that. So I'm not really, it's about 9 seconds. I don't know what happens when this timer reaches 0. Does it end the call? I'm not sure. But no, I would
it won't end the call, so please answer the
question. Okay, great. Right. So just to go straight up to the question, let me first start by saying the rural people suffering trope is a bit overemphasized and a bit over-exaggerated. And I say this because I have experience here. Again, I started my career as a village medical officer in a very wonderful place in Oyo State, in Igeti. And I also happen to come from a very, very rural riverine area, a place called Tongeji Island, which I'm sure most of you don't even know exists in Nigeria. It's somewhere on the coast of Ogun State and Benin Republic. So when it comes to rural health, I know quite a bit about that. And let me start by first saying the Nigerian government has made significant progress when it comes to digitizing rural pathways. Internet penetration in Nigeria, according to the according to the Nigerian Communications Commission and according to the International Telecommunications Union, is now at 81%. So, particularly in southern Nigeria, it's probably closer to 90%. you will be hard pressed, and I say this with a lot of respect, you will be hard pressed to go into rural areas, and I mean real rural areas now, where you would not find someone with an Android phone, and you would not find someone connected in some way, even if it is slow, to the public internet. You would be hard pressed to find. And I say that because I go to these places pretty regularly. My hometown is literally one of such places, right? And so the truth of the matter is, the reason why rural people are still isolated and are not incorporated is because we are not building for them. Simple as that. It's not profitable to build for rural areas. So private sector is not particularly motivated to do that, because you cannot build for them and charge the same price as you would charge in Ikeja in Lagos, right? So the exclusion of rural areas is not a infrastructure or fundamental infrastructure problem. It's an economic problem. It's a problem that stems from the fact that the economic incentives are not aligned for delivering on rural healthcare. And it is not a Nigerian thing. Anywhere in the world, rural healthcare is the government's job because it's a social good, right? You do not expect private sector that is motivated primarily by profits to take up the job of the government in these spaces. And so if we really want to build technology that will not be exclusive, that will not worsen the digital divide, we need to do two things. First is, yes, we need to make sure that the technology that we're building by design is not built in a way to exclude rural people. So for example, if you're building infrastructure technology and you make it high bandwidth requirements, you make it, super advanced, it does not work offline, you are obviously clearly building to exclude rural people. And if the government allows that to go through, then basically you have excluded rural people. So we need to make sure that on the building side, on the builder side, which is where most of us are, we are building pieces of technology that can survive in the realities of rural areas, which is poor, little to no internet connectivity, little to no computers in sight, very low-end basic Android phones and things like that. You need to build for those realities, right? But at the same time, if I sit here and tell you that it's the job of entrepreneurs to solve the digital divide, I'm lying. It's not. The entrepreneur's job is to return investment to his shareholders, is to make profit, and he's a private sector player. So expecting startups to solve that problem is the reason why healthcare startups are dying in Nigeria. It's a government problem. The government should incentivize building for rural areas. And you would see how many startups and how many private sector entities begin to build for those areas, right? I go back to the fintech example. Fintech is everywhere. As rural areas are, as rural as my village is an island. The only way to get to my village is through speedboats. We don't have roads that go to my village. It's an island, literally. And as rural as my village is, we have money point POS in my village. Just so that we're clear. There are OPay stands in my village. And I repeat, for you to get to my village, the only way to get to my village is you get on a boat somewhere in Apapa or Ijiroko, depending on which part of it you're coming through. And you go on the high sea for about 45 minutes to get to my village. And even at that, in my village, when you drop off and you see welcome to Tongeji and you see people in my village, there are POS stands. Just to make it clear that if the incentives are aligned and the incentives are right, technology will get anywhere in Nigeria. That's just a fact. That's not theory, that is just a fact. So what the issue is with the digital divide that health technology is causing is that there are no incentives to include rural health spaces. Rural health spaces themselves are not structurally excluded. They are being economically excluded. And I think I need to make that very clear to everyone in this room. And so when you're building on the builder side, yes, we need to be responsible in how we build technology and make sure that it is going to be able to survive the realities of rural deployment. But it is not our job to make that deployment viable. That is what the government has to do. They have to incentivize making that deployment viable. Let me be clear. If I build a company that is producing syringes and needles, for example, and that's my business, I'm not going to be worried whether Tongeji Health Clinic has syringes or needles. To be fair, I'm going to focus on the hospitals in Lagos Island, maternity, and because that's where I'm going to be able to make margins, right? But if the government of Ogun State, for example, now realizes that we need to make sure that Tongeji Health Clinic has needles and syringes, then they make it reasonable for me to deploy there. And then I'm more than happy to send needles and syringes there and take all of the headache there. But I'm not going to, by design, make it my business to get needles and syringes to Tongeji Health Clinic. That's not why I got into business, right? And so I think we must be clear about what we should be doing, which is what I've talked about, and what the government should be doing, which is also what I've talked about. Because trying to lie to you and tell you that it is the job of entrepreneurs or the private sector to fix rural healthcare is just me telling a bloody lie. I am lying. But I also need to be clear that the rural health systems are not anymore excluded by structural disadvantages. Yes, there are still structural problems, but they are not as pronounced or as terrible as things used to be 20, 30 years ago. I think in terms of communication and connectivity, I think Nigeria has made significant progress, leaps and bounds. And so there's enough weak infrastructure to work on to reach some of these places, genuinely speaking. And I'm not going to sugarcoat that, genuinely speaking. And just to go back a bit on the what should we be looking at into the future question, because I kind of rushed it a bit because I thought this call was going to end at the end of that timer, but since it's not, then I think I should talk a bit more, just a little bit more about that particular question, which is what should we be looking at into the future. Let me say a couple of things, and I say it, very clearly. We have a problem, a serious one on our hand. We've talked about some of these problems, and I know you know what I'm talking about now. But there's one more problem that we need to think about and we need to talk about very honestly. And the problem is that skillful people like you and me on this call are getting less and less available for the health system. I went to medical school at the University of Ibadan. I trained as a doctor there. I started medical practice in University College Hospital in Ibadan before I moved out. And all the people who went to school with me, more than 90% of them are no longer in this country. All the people who went to school with me. I went to school, my medical graduation class was 176 people. And I'm telling you that more than 80% of that 176 people no longer live or work in Nigeria. And that's just one example. We are hemorrhaging talent at an alarming rate. And what that means for the rest of the health system is that we're losing expertise, we're losing knowledge, and we're losing skill. Automation in such systems becomes more existential and not less existential. People are burning out. Scientists are hating shifts. They are literally dreading to go to work. Pharmacists are drowning in work. Doctors are literally going on strike every other day because of work conditions. What that is telling you and me is that automation is going to be more important and not less important. And so if you and me are thinking of entrepreneurial opportunities, technology opportunities, places that we can come in, I would say without question, over the next 5 to 10 years, what you should be spending your time investigating is where are the automation opportunities and can you build those automations? Because when human power is in short supply, automation is almost always the answer. It happened in the manufacturing industry, happened in the car industry, happens in even the weapons industry right now. It's happening in the weapons industry right now. So automation is going to be so important to meet these shortages, because unless somehow we're able to stop the brain drain and stop hemorrhaging talent, we are going to need to automate workflows a lot. Otherwise, the few people who are left behind are going to even leave more because they're going to get tired of the constant burnout and they're going to quit. And so as people who are interested in solving problems, which is what everybody is on this call, I would sound the alarm and sound the call to action to you and say, the opportunities are in automation, and that could be hardware automation, software automation, it could even literally be process automation, whatever the case may be. But you need to start thinking about, and I'm speaking for the tech side now, not the business side, what you should start thinking about is how do we automate across some of these classic workflows, right? The technology is already there. Some of it is even very basic, right? And we need to start building for that. I'll use one real example in the US system, and then I'll bring it back home. One of the most valuable technology startups in America today is a company called Ambient Scribe. It's worth $4 billion. They were established like two and a half years ago. It's worth $4 billion. They are currently working towards, listing on the New York Stock Exchange. Ambient solves a very simple, straightforward, basic problem. And what is the basic, straightforward, simple problem we solve? Ambience provides a piece of technology that the doctor sets up in their consulting room, and they consult with the patient normally, the way they would normally consult. They ask the patient questions, the patient answers, they probe for some more, the patient answers. And at the end of the consulting, Ambience is also there listening to that entire conversation, and Ambience generates the doctor's documentation automatically at the end of the consultation. That's how it works. Now, this is not the same as speech to text, so you don't get me wrong. It is not that the doctor is dictating into a software while they are talking to the patient. That's not how it works. Ambience, the doctor does not need to dictate anything. Ambience basically comes into the room with the doctor, listens to the entire conversation that the doctor has with the patient, normally like a third party would listen. And at the end of the consultation, Ambience prepares the doctor's documentation automatically. It is a $4 billion company. It's used by more than 40,000 doctors in the US. Nigeria needs one. Now, I'm not going to build it. I already have what I'm tackling. I can't tackle everything. But somebody needs to think about how to build that. Because 90% of the stress of a clinic day is actually in documenting. I know this because, I'm a doctor. I practice medicine. I know this. You look outside your room and there's 40 people waiting for you in the OPD. And for every single one of them, you have to document your work. You have to document everything for them, write prescriptions, all of that. It is hectic work. If someone builds that, you are going to have a massively valuable company on your hand because doctors will buy it. As much as we say that they don't have, of course, if you don't price it ridiculously, obviously. If you price it reasonably, doctors will definitely buy because it is a real painful problem for medical professionals to document, right? So we need to start thinking about more of that, things like that. How do we automate processes? How do we shorten workflows for doctors, for pharmacists, for nurses, for laboratory scientists, for physiotherapists? We need to start thinking about what are the things that are tedious in their workflows and help them shorten some of those gaps. Those are the opportunities that I think the next 5 to 10 years are going to unlock for the healthcare system. So yeah, I just wanted to make sure I expatiated a bit more on that. So that's that. Thank you very much.
Thank you, Dr. Imodoye. Thank you for making it so practical, for making it so real. We'll be heading on to next section of the workshop now. But for the sake of emphasis, I just want to emphasize 2 things that Dr. Imodoye said. For the entrepreneurial side, you can make your solutions go as wide as possible if you add reasonable incentives. Pay attention to that. And then for the tech side, you should pay attention to automation. That is where the world is going. Thank you so much once again. I cannot express my gratitude. So I'm sure everyone on the call has benefited so much from the session. And again, we can listen to it. It will be available on our YouTube channel thereafter. And of course, people that want to engage you after now, they can reach out to you via LinkedIn and by email as well. So we'll be heading on to the next section of the workshop now.